Hello, I'm Dr. Vince Leone, and I'd like to personally welcome you to New Life Chiropractic. I would also like to thank you for taking the time and the energy to come into our office and taking that leap of faith. I know it's not easy finding a new doctor. In fact, it can be scary at times. And so I want you to know that here at New Life, we're going to do everything we can to make you comfortable, but most importantly, find out what the problem is and whether we can help or not, okay? And so in just a few minutes, I'm going to be in and we're going to do an exam, we're going to do a consultation, and if necessary, we're going to take some x-rays. But in the meantime, I'd like to take you, just have you relax for just a couple minutes, and I'm going to have you listen to a couple of my patients share their stories of their experience here in the office. The first one, her name is Mary. She came in with chronic back pain, and what actually turned out, she also had fibromyalgia that had resolved in the course of her treatment that she did not mention early on. So just sit back, relax, and listen to what Mary has to say.
I'm Mary. My name's Mary White, and I came here to the chiropractor because I thought that I just needed help, because I've experienced before what a chiropractor is and what it means to me. And I have found out that I have, during the first week of my help here, I experienced a lot of different feelings, and mostly it was the experience of feeling well. My back felt really good. I've had experiences during each week and it has been different, and I feel that each time that my back is feeling better. I wasn't able to stand for a long period of time, or actually any time at all, and I found out that there I am standing and my back wasn't hurting, and that's great. And also there was a snap in my leg somewhere, and my leg is not snapping anymore, so I'm really happy, and I appreciate Dr. Leone.
Okay, welcome back. So that was Mary. Mary's the sweetest patient. She's awesome, and she was so fun to work with, and she just, she thought this was something that she was going to have to live with for the rest of her life. And now she is able to have a much better quality of life, play with her grandkids, etc. So we love those stories. A lot of people don't know, fibromyalgia, chronic neck and back pain, restless leg syndrome, numbness and tingling in the hands and feet, pain in the hands and feet, chronic fatigue. These are all things that can be helped, and not in every chiropractic office, but we have a very specific protocol for each of these different conditions that we use that no one else uses, frankly, or very few physicians use in the country. Okay, that's why we're so effective. Okay, so this next patient, her name is Laura, and she had shoulder pain. She had a fall. Not a very complex case, but she did very, very well. So here's Laura.
Hi, I'm Laura, and I've been coming here to New Life Chiropractic for about 3 months. What brought me here was after effects of a fall in late spring. My right shoulder had debilitated down to 0% range. I was not able to use my arm. And since I've been coming here and seeing Dr. Vince, I have 90% use of my arm, less pain, and I have more energy.
Okay, now this next patient, his name's David, and he is in the Army and had recently got back from Iraq when he came into the office. And I mean, he literally got blown up. He was in a Hummer vehicle, the big trucks, and they ran over what's called an IED, which is a bomb basically, and it blew the truck on its side, and he could barely walk coming in, and so he had severe low back pain, and he did wonderful, and he was thrilled, and then he actually. As soon as he got done with care here, he actually shipped off, I think it was Colorado, and he was going into Special Forces training. So he went from being injured in an explosion to rehab to a point where he could go into Special Forces training, which is extremely intense. So this is David, and listen to what he has to say.
Hello, my name is Sergeant David Rascone. I'm a veteran of Iraqi freedom. I went through an explosion just recently, and I came back, and my back was really messed up. There were mornings where I couldn't even wake up and stand up, and I really had no idea what was wrong with me. And like most things, I tried to toughen up through it until I came here and been getting treatment, and every day I'm just feeling better and better. I can feel myself physically getting better, and that's pretty much it.
Okay, so that was David, and honestly, that's why I do what I do. We have people fighting overseas. They unfortunately do not get the best care over at Madigan because they have one chiropractor there for how many thousands of soldiers, I don't know, and he's absolutely inundated. So David just decided to, hey, come here and just pay out of his pocket. But it was worth it to him because he could barely move and couldn't get into Madigan to see, the chiropractor, and they were just giving him pain meds and muscle relaxers, and it wasn't doing anything, obviously. So, okay, so the next one we have is Eleanor. Eleanor was a special patient. She was, came in, she was all grumpy, and she just, had a very poor quality of life. She had a total turnaround. Once again, another reason why I do what I do. I love this stuff. It's so fun to see people get their lives back. So this is Eleanor.
Hi, my name is Eleanor, and I just wanted to tell you how great it's been since I've been here. This is only my third time here, and I came in totally miserable. I could barely walk, and Dr. Vince has helped me so much. This is my fourth treatment, and I feel so much better, and I would like everyone to know what a good place this is and how wonderful it is to meet such kind, helpful people.
Okay, so very brief and to the point she is. Anyways, the last one I have for you is Louise, and she had mid-back pain and shoulder pain, and she'd never been to a chiropractor ever. Didn't believe in it, frankly. Saw one of my ads, was able to, when she read it, get a grasp of what we do here and why we're different and why she's been having this pain for so long and no one else has been able to fix it. Okay, so hang tight, we're almost done. This is Louise.
Hey, I'm Louise,
Uh-huh.
and I came in with some problems with my shoulder, upper shoulder here, chronic pain for probably a good 3 or 4 months. Didn't know I hadn't had any injuries that I could identify or anything. And the doctor here kindly has been adjusting me for about the last, 2 weeks or whatever, and today was an absolutely fabulous day because I had no pain in my shoulders or in my neck. And I think that we're getting on the good foot now.
That's
so
awesome.
to speak. So it's really a good day today.
Great, thank you.
Thank you.
Okay, so Louise, another wonderful patient, a pleasure to work with, and great to see when people had no idea where to turn, that they find me and they just get these massive changes, and all of a sudden there's no more pain. I mean, it's just no fun to live in pain, as you well know. It really works into your psyche and affects all areas of your life. So anyways, so I'm going to be in a second. Now that this is done, I want you to go ahead and crack the door just a little bit. That's going to let the front desk know that you're ready, and then I'm going to be right in, and we'll go from there. So I appreciate your time and attention listening to these stories, and I'll speak with you soon.